Latimer City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
And I don't know if it's easier for you people to understand me without the microphone.
No, use the mic, mate.
Should I use the microphone?
Yeah, use the mic.
Okay. Is this any better? Yeah. Okay, because the echoing kind of interferes with my hearing. Anyway, my name is Ron Patelka, and the good Lord permitting, I'll be 80 years old next week. And my story started back about 20 years ago when I was diagnosed with prostate cancer. For me, it was a matter of not will you, but when, because of family history. And family history is a very significant factor with prostate cancer. Actually, prostate cancer is the second most deadly cancer, right behind lung cancer for men. Anyway, I was totally asymptomatic, and I was flying at the time, and I was going for annual FAA physicals every spring, and the doctor that did my physicals actually had prostate cancer, so he was very adamant about doing the digital and the PSA exams. And the exam that I had in May showed that everything, was normal. And in Illinois, in September, which is National Breast Cancer and Prostate Cancer Month, most of the hospitals do free breast exams and prostate cancer exams, PSAs and digital exams. And my PSA in the springtime was around 2, and in September I got a card in the mail about a couple weeks after the free exam, and my PSA had gone up to almost 5. And 4 is kind of the borderline. Anything over 4 is generally, something that you should be concerned about and have checked. Anyway, I had a biopsy, and I was living in Dallas at the time, and I had a very good urologist. In fact, the urologist that did my biopsy and his father were a team that were Mick Jagger's urologists. It's too close? Okay. Anyway, I had a biopsy done, and I came in about a week later, and the doctor pulled up a chair in the examining room, and he said, "Ron," he said, "you have the real deal." And this was, again, just in a few months, So I did a lot of studying. Actually, I had been studying prostate cancer for many, many, many years, knowing that most likely I was going to be diagnosed with it someday because of my family history. So I did know quite a bit about it. So I went through the usual scenarios of trying to decide what was going to be the best course of action, radiation, surgery. At the time that I had my surgery, which was again about 20 years ago, surgery and radiation were about the only two therapies that they had for prostate cancer. And I decided on the surgery, and I had a doctor in California at the UCI do it robotically, and the surgery was no big deal, and recovery time was nothing. But unfortunately, a few years later, the cancer recurred. And this is what my presentation is going to be about today, the recurrence of it after radiation or after surgery. If you have no prostate or it's been radiated, you should have no PSA. And if your PSA goes up to 0.2, not 2, but 0.2, you know that you have recurrence of the disease. Anyway, let's see. Where is the? And do we have a laser pointer? Oh, here it is. Here it is. Okay. And
so that's forward. That's backwards.
Okay. And
that's the left.
Okay. All right.
Forward.
Okay. Thank you. Thank you.
Just point it this way because that's the. So just.
Oh, okay. We have a monitor here. Okay. All righty. Okay. And this is a list of some of the famous men. The previous photo or previous slide showed some of the pictures. The problem with prostate cancer is if it's diagnosed at a relatively early age, it is usually very aggressive. And I strongly urge every man to get a digital and a PSA exam at least once a year. The majority of the men that are diagnosed with it in their 40s and 50s are going to die from it rather than with it because it is aggressive. One of my favorite singers, Dan Fogelberg, who did a song that I loved, the leader of the band, about his father, he was diagnosed with prostate cancer at 53 and he died at 56. So it can be a very aggressive disease. Anyway, I ended up having the surgery robotically in California, and a few years later it recurred, and I've always been totally asymptomatic. I mean, I never had any idea that I had the cancer. And the problem is after it reoccurs, or after it recurs, about the only thing left to do is, and they're still doing it based on research that a Dr. Huggins in 1941 came up with. He came up with the hypothesis that testosterone was actually the food when prostate cancer recurs. Testosterone can be good and bad, and if I can ask a few of you gentlemen that lost your hair or started losing your hair in your early, let's say 30s, if I can ask you a question without embarrassing you about prostate cancer, could I have a show of hands? Any of you that were losing your hair in your 30s? Well, have you had any problems with prostate cancer? No. Okay. That's a good example. The testosterone, which causes the DHT and causes men to lose their hair, is actually a very healthy androgen or hormone for the prostate. And the majority of the men that have high testosterone levels, again, that will lose their hair or start losing their hair in their at a young age, will never have to worry about it. Now, a few months ago, I believe we had a presentation by a doctor from Bangkok Padi Hospital about transurethral resection of the prostate, which, I'm sorry? Yeah, I wasn't here for it, but my hearing is very bad, Ren. But that was a presentation on BPH, which is benign prostatic hyperplasia.
Yes, it was about how to treat inflamed prostates using a new technique called water vapor therapy, where they put it up to the prostate and they use steam, very hot steam to kill it, and it seems much safer. It's really worth going on and learning about it. Water vapor therapy, very good.
Now, BPH, or simply an enlarged prostate, is not prostate cancer, and it's something that many men, most older men, end up suffering with, which causes an inability to completely empty the bladder, and because of the enlargement of the prostate. So prostate cancer is something that's totally different, and I never had that problem. But anyway, after the after the surgery, and a few years later, when my PSA went to 0.2, let's see here. This, I'll talk about this here. All right, and the laser pointer is, what am I doing wrong here? Okay. All right, at this point here, you can see that, and this was about, about 10 years after my surgery. My PSA was at 0.2, which was an indication that the cancer had recurred. And so I was going for checkup for PSAs, and prior to being diagnosed with prostate cancer, PSA is only a cursory indicator that you may have a problem. But after you've had your prostate removed or it's been radiated, you should have no PSA. Actually, at the time I had the surgery, there wasn't a whole lot available. Now we have other methods, other therapies, and if I had it all to do over again, I would probably choose either brachytherapy, which is the implanting of a radioactive seeds. They use an MRI to identify the tumors in the prostate, and then they inject these radioactive beads or seeds right into that tumor, which end up killing the cancer. It depends on how far advanced the cancer is. If the prostate is totally, infected with the cancer, then that is not a choice. But if it's caught in early stages, many people that I know have had that done. We also have another technique now, which is far better than what the conventional radiation was when I had my surgery, and that is what they call SBRT, stereotactic body radiotherapy, where they actually have multiple beams. They identify the tumor in the prostate, and they have multiple beams that come in from different directions. Again, that's why they call it stereotactic. And each one of the beams by themselves doesn't do any damage to peripheral tissue. But when they intersect with one another at the tumor, that's where they do their job. But that was not available. That wasn't an option when I had mine 20 years ago. Anyway, since the cancer came back, about the only thing left for someone with recurrence of prostate cancer is androgen deprivation therapy, which is basically castration. And you can either have your testicles surgically removed, or you can have there are many different drugs that attack the receptors, and they also have many different drugs. Some of the drugs are like over $100 a day for one pill. And the most common therapy right now for the recurrence of prostate cancer is Leupride or Lupron injections every 3 months. In America, these injections are $6,000 every 3 months, and what they do is they chemically castrate you. Again, going back to Dr. Huggins in 1941, he determined that testosterone, was a good and a bad thing. Again, it keeps the prostate healthy, but if a man does develop prostate cancer and he has surgery or radiation and it comes back, then testosterone is food for the malignant cells that that remain. The testosterone cannot discern the difference between a healthy prostate cell and a malignant one. So after we've had primary therapy, radiation, or surgery, the cells, the malignant cells that are left over, are fed by testosterone. So androgen deprivation, basically castration, either hormonally, surgically, or with chemicals, is the basic way of treating it. Most men have Lupron injections every 3 months, which are, in America, they're $6,000. And the majority of the men that are on Lupron have terrible side effects. They have hot flashes like a woman going through menopause, because what happens is when you lose your testosterone, you also lose your estradiol, which is what happens to women when they go through menopause. That's why so many women end up with osteoporosis during menopause or after menopause, because of the lack of estradiol. Estradiol is one of the 3 main estrogens, and it's the most potent of those 3, and it's responsible for maintaining bone density. And so the problem with the Lupron injections is when you lose your testosterone, you end up losing your estradiol. And so, and again, the side effects, the fatigue, the bone density loss, the mood swings that most of the men who are on these Lupron injections are devastating. And so I decided that that's not something that I wanted to do. Anyway, my significant other, Natalie, she's in the real estate business, and she has a visa service, and she's also a legal consultant with a lawyer, Quinn Mack, over in North or South Padia. Anyway, she had a ladyboy girlfriend that we were out to lunch with, and the ladyboy was going through her purse, and she happened to pull out a tube of something that I looked at, and I ended up taking a picture of it, and I posted it on the prostate cancer forum, on one of the prostate cancer forums that I am on. And a doctor in Vancouver, a Dr. Richard J. Wassersug, who's written books on androgen deprivation therapy, he was on the, or is on the forum. He sent me a message and said, "Ron, can you call me?" So I called him, super nice guy. We were on the phone for 2 hours. And he told me about this hormone. Again, some of the lady boys take it. The only side effect that I have from it is gynecomastia, which is one of the reasons why the lady boys take it. And other than that, I have no idea that, at the moment that I have prostate cancer. Other than, again, I'm kind of embarrassed. I go to the gym almost every night, and I'm very careful about the kind of shirts that I wear, because it is a little embarrassing. But anyway, estradiol can cause you, because it's a hormonal androgen deprivation therapy. It actually can cause you to lose a lot of strength and can cause depression. But I still exercise. I've been exercising all my life. I never drank. I never smoked, and I still go to the gym every day. In fact, I installed a bar on my balcony, and every day I do 2 sets of pull-ups, of 12 to 13 pull-ups with my arms wide and this way. So I still have some muscle mass, even at 80 years of age, or almost 80. Anyway, Dr. Wassersug had told me about this estradiol, or estrogel, and he said, "I've been using this for 20 years. He said, "I refuse to take the Lupron injections because of the side effects and the fact that the lack of testosterone." Again, estradiol is aromatized from testosterone, so when you lose your testosterone, you also lose your estradiol, which again is what causes osteoporosis in women. So Anyway, he said he's been using it for 20 years and that his PSA is undetectable. And as you can see, when I found out that my cancer was back at 0.2, I waited a little while, was hoping. I go to the Bangladesh government hospital for my blood tests. They're very reasonable. I think I pay like $30, around 1,000 baht for 3 blood tests. I get a PSA, I get an alkaline phosphatase, which is an indication of bone activity, and actually I get 4 of them, and I get an estradiol, and an estradiol level, and a testosterone test. Anyway, I started using the gel right here, and you can see after I started using the gel what has happened to my PSA. My PSA is now undetectable, which means that the gel is doing its job. And again, I have no side effects other than you know, the gynecomastia, which is no big deal. You know, I don't even realize that I have it other than when I look in the mirror. But anyway, I brought a number of tubes that I was going to pass around in case some of you people wanted to take a look at it. But I hope that there's no one here, but maybe I'm wrong, that has prostate cancer. But, that beg me to send it to them. And I think that the pharmaceutical companies and the doctors in America don't want it sold there because it would eliminate the $6,000 tri-monthly Lupron injections. I haven't been to a doctor since, it's been about 6 years now. Actually, I don't think I'm repeating myself here, but I've had 3 unsuccessful surgeries. The prostate radical prostatectomy 20 years ago, which again has come back, the cancer came back. And then about 10 years ago, I was in Dallas, and a friend of mine that knew that I had prostate cancer, she had recommended that I go to get an MRI, and the MRI located a small mass in my left kidney. And none of the doctors, and I was going to Baylor Hospital, which is a good hospital in Dallas, and I talked to a number of doctors, and nobody wanted to do a biopsy of the kidney because they said that when they would pull the needle out, if it was malignant, it could spread. So unfortunately, my urologist talked me into a nephrectomy. I was in the hospital for 5 days, and he came into my room on the 5th day and he said, "Ron, I have good news and bad news." He said, "The good news is it was just a harmless cyst. The bad news is you lost your kidney for nothing." Anyway, when my PSA started going up, before I started on the gel, started using this gel, I ended up going down to Melbourne, Australia for an extremely sensitive scan. It was the most sensitive scan for cancer at the time. I would have had to go back to America. I have Medicare insurance in America, but it doesn't cover me here, so I have no health insurance here in Thailand. And anyway, the trip to Australia, to Melbourne, was a lot faster and a lot less expensive, and the charge at the hospital for this scan was about 1/3 or 1/4 of what it would have been in America, even with Medicare, because there's still a copay. Anyway, the scan identified a number of lymph nodes that the cancer had metastasized itself into. Unfortunately, I let the doctor in California who did my original radical prostatectomy robotically, I think he wanted to get more practice with his robot, but I allowed him to talk me into removing those lymph nodes, which was another surgery that should have never been done. The problem with removing the ones that were identified is there's no scan that can identify all of them. Again, this scan could only identify lymph nodes that were that had tumors or were affected by the cancer that were 3 millimeters and larger. So by him removing the ones that were identified, it did nothing because my entire body, was loaded with lymph nodes that were cancerous, that the cancer had metastasized itself into. So anyway, the only thing left was Lupron injections again, which I decided I didn't want to do, and so the lady boyfriend of my significant other, my girlfriend, happened to pull this gel out of her purse. I took a picture of it and I posted it on the Prostate Cancer Forum. And this Dr. Richard Wassersug, who's written a number of articles and books on androgen deprivation therapy. And he's been, let's see, there we go. Anyway, he's on the Prostate Cancer Forum, and he sent me a message and said, Ron, can you call me? So anyway, he talked me into starting on this. But again, you can't buy it in America, but I can buy it here for $10 a tube at any pharmacy. And so I've been using it now for about 5 years, and my PSAs are undetectable, which I'm not saying that the cancer, that I'm cured, but it's sleeping. And it's been sleeping for a number of years now. My last few PSAs were 0.006, which is considered about it. In fact, none of the labs can analyze a PSA any lower than that. So that's the NADR, the lowest point. Anyway, I just wanted to mention to you people again. I had the lymph node surgery, and I had the prostate cancer surgery, and I lost a kidney for nothing. So I had 3 surgeries that were all, in fact, it's kind of interesting that before the other gentleman's presentation, they had asked about how many people had faith in doctors. I hope we don't have any doctors here that are offended by this, but after the 3 surgeries that I had, I've kind of lost faith in doctors also, obviously, which is understandable. Anyway, I don't think there's much else that I need to tell you other than the fact that I am asymptomatic. I have no idea that I have prostate cancer, and again, I've been dealing with it for 20 years now, and I still, I exercise every day, and I feel great. Any questions?
Yeah, thank you for that. Yeah. I like the deal about the ladyboy. Can you talk more about that or not? No. No, my son, I don't know, maybe 6, 7 years ago, had those beans you're talking about, or peas, that they shoot at his prostate.
Right, you mean
when you were talking about?
The
laser
radioactive
beans,
the seeds,
peas or something, whatever?
The radioactive seeds,
yeah,
that are injected into the prostate, and they target the tumors.
Anyhow, the result is that he lost his erection pretty much. Is that common for that to happen?
I'm sorry, that what now?
He can't get a hard on.
No, generally no. I have a number of friends that have had the brachytherapy. Unfortunately, that was not an option when I had my prostate removed. But I didn't mention that. But I'm ever since I had my radical prostatectomy, I've been impotent, and about 10 years ago, incontinence started, and it's all because of the fact that I lost my prostate. And so, you know, for 20 years now, I've been pretty much worthless. And about a year after, about a year after I had my prostate removed, I had talked to the doctor, and I said, Doc, I said, you know, I have no libido. And he said, well, that's probably a good thing because you can't do anything anyway. So, anyway, I hope I didn't bore you with this, but
yeah, I don't know.
My hearing is really bad. So.
I don't know if you can answer my question, but African Americans have double the rate of prostate cancer over white Americans. Can you tell us why?
I'm sorry?
African Americans have double the rate of prostate cancer as white Americans.
Americans, you said?
Yes.
You know, part of it maybe is diet. You know, I don't know what to tell anyone how they can prevent the prostate cancer. I mean, knowing that I was going to get it because of my family history, I was doing everything possible that, you know, I read, saw pimento and all kinds of vitamins and everything, and exercise, and I ate fairly well, and I did everything that I could that, you know, I thought would help prevent it. And so I really have no recommendations to anyone as to how to prevent it.
Okay, one more. There's a doctor, in fact, Dr. Tim, he's an American doctor at the hormone clinic at 3rd Road and Paddy Klang. Mm-hmm. He claims that even though if you've had your prostate removed, that he can take care of you all kinds of ways. I don't know.
As far as impotence?
Just a thought for people, you know. I mean, he's a good guy. And he's really, I guess he's really not a doctor here, but he was like a hormone doctor in America. But his wife is a Thai lady, and she's actually the big doctor there. But just some information for you guys.
Wow. Let me put there's my email address. If anyone wants to, or
Dr. Tim
has something that they would like to send me, I would appreciate it. Or if you want to contact me, and I can give you my phone number, and we can talk. Yes, sir.
My family has a big history of prostate. Can you hear me?
No,
yes.
I can't hear.
Try this mic. Yeah, my father and my brother both died prostate. I have high prostate readings, so I self-medicate over here. So are you advising that you just put one of this dab of cream on my digit and rub it directly onto the prostate? Is that how it works? And do you do it every day?
How do you use the cream?
Pardon?
How do you use the cream?
Oh, I'm sorry. There's a little applicator. Again, I think I sent the tubes around. There's a little plastic applicator right here. Put the line on here, and I just squirt an amount about that much on there. In fact, I think I have a slide here that shows that. There we go. And I apply it to my inner thighs, and I do it like once a day. Originally, when I started, I was doing it in the morning and doing it at night. The really great thing about this is it's transdermal. Years ago, they were treating men with a synthetic estrogen pill when they had recurrence of prostate cancer was called DES, diethylstilbestrol. And the problem with the oral medication is it ended up going through the liver, and there were a number of men that ended up having cardio problems. Actually, I think the pharmaceutical companies wanted to promote their Lupron, and so anyone who happened to be using the DES, the pill, the synthetic estrogen pill, that had a cardio problem, they always blamed it on the pill, even though he was predisposed to having cardio problems anyway. But anyway, the thing about the estradiol is it avoids the first pass hepatic metabolism through the liver, and that's the big plus. DES was extremely effective, but it was taken off the market. It was banned in 1985 and replaced again with these Lupron injections. They banned it because they claimed that there was a much greater incidence of cardiovascular problems, and again, they blamed it on the pill. But it was extremely effective. My grandfather, my father, my uncles, they were all on it, and it did a great job of reducing or hormonally castrating men. Again, the testosterone is the food for the recurrence of the prostate cancer. So that is still the mainstay treatment for recurrence. Anyway, it does make you pretty much impotent. Losing your prostate, is bad enough, but then with this here, because it's a hormone castration. Hormonal castration, again, I have no libido, which is no big deal anyway, since I'm almost 80 years old, and so I don't worry about it. But it's
actually, Brian was there at the time, the Alternative Club, about 8 years ago at the Mercure. This guy stood up unexpectedly and turned round and said, "I had lung cancer, I've treated myself, and the doctors are amazed because it's gone." And he talked briefly about baking soda and honey. Somehow he turned the baking soda into a tablet and coated it with honey. Now, according to some experts, honey attracts cancer cells. They love it. But it was a inside baking soda that once the cancer swallowed the baking soda, it destroyed it. That guy never came back, so I can't really confirm any further. He probably died of consumption of baking soda. But he actually stood up. Were you there, Brian, at the time? Brian was there. And everybody was stunned by it. Baking soda, and somehow he accumulated into a pill and actually coated it with honey. There you are.
Thank you, John.
Well, anyway, the advantage to this is, again, it avoids going through the liver. It's transdermal, and it's been doing a great job for me.
Last question over here.
Dr. Wassersug's been on it for over 20 years now, and he's the one that, again, he's my mentor. And yes, sir.
Yeah, my understanding is the gel is primarily used for women from menopause, and there's some side effects for them. What is the side effects for men?
Who was the gel designed for? Was it designed for ladyboys originally, or?
I'm sorry?
Well, the gel, it wasn't designed to treat prostate cancer.
No, it's actually for women going through menopause.
Okay, so there's a big takeaway for the women as well here.
Because it causes breast enlargement or gynecomastia in men, many of the ladyboys end up using it. So.
Well, I think you could all use your hands in a non-traditional way that men use hands. And give him a round of applause for a wonderful talk. Super talk. Thank you, Ron. And I certainly, I mean, he's one of the oldest speakers we've ever had. He's the only guy I've ever heard give a talk, get up here and say, you know, I'm impotent. Not expecting that to happen again anytime soon. So, huge plaudits for a truly honest talk and a very powerful journey you've been on, Ron. Thank you. Come on, we'll take a photo of you. Put that down for a second. Yep. Here we go. Here's your plaque. And honestly, I've never seen so many cameras come out to take a photograph of something as when we pass that gel around. So either that means people are taking precautions or they've all got ladyboy girlfriends. You know, I don't know. One of those two things.
You know, hopefully none of you have, you know, are dealing with this problem, but if you know anyone that is, you know, is getting these Lupron injections, you might suggest this gel as an alternative.
Yeah, fantastic. Fantastic practical takeaway. One tip, thank you, Ron, you can go and retire now. Have a seat. You've done fantastically. Fantastic talk.